Hi, everybody. For everybody that doesn't know me or didn't hear my introduction, my name is Derek Robinson. I'm on the Academic and Industry Relations team. I manage districts 10 and 11 for ASDA, and I deal a lot with a lot of dental students and dental residents. So we'll be talking about that briefly. I'll also do a nice introduction to what Aspen Dental is before we introduce our man of the hour. Also as well, I am going to show this opportunity, if everybody can see this. We're having until the end of the year, due to the pandemic, a free CE opportunity to visit and check out all of our CEs in our CE library on top of CEs that you'd be able to participate in. This is offered by everybody that can hear to all dental students and all practicing dentists that are not a part of Aspen Dental as well. So take a look at it out, aspendentalce.com/welcome. And all you got to do is just sign up and you'll have access to that library of CEs on top of future upcoming CEs as well. So it's a great opportunity for dental students and non-Aspen dentists. Just to give you an idea again, we are Aspen Dental. We're a dental support organization. I'll go into the details of that, and then maybe we can have Dr. Lamoureux kind of say his side as well. So let me slowly introduce Dr. Paul Lamoureux. Hi, Dr. Lamoureux. How are you today?
Hi, I am very good, sir. Very
good. Sorry, I'm trying to juggle like 9 boxes at the same time. So if anybody green, that's because I got questions to my left and questions to my right. It's a pretty cool setup. So real briefly, I just wanted to for all those D1 there, or those that have no idea about what Aspen Dental is, we are a dental support organization. We have over 800 offices throughout the United States. I believe we've reached into 43 states at this point now. We've just recently opened up in California, and I'll let Dr. Lamoureux kind of take it from there regarding what he does. So Dr. Lamoureux, take it away.
Yeah, thank you, Derek. So my name is Dr. Paul Lamoureux. I'm a 2019 grad from OHSU. I was very active in student leadership. I was our class president all 4 years. I was very active in ASDA as well as the ODA. So I served as a trustee to both the Oregon Dental Association and in my senior year, as a trustee for National ASDA for District 10. So if you aren't in ASDA, that's really one of the big advice things I can give you. Like that will give you, a leg up over, people that just kind of go through dental school and don't do any of the extracurriculars and things. I've been with Aspen since I graduated, so I'm, powering into my second year of real dentistry here. But in Aspen, your experience level is like dog years. So really, I have 14 years of practice under my belt now.
What is your position?
I'm what's called the managing clinical director of my office. So that's like the lead dentist position. So as well as doing, the basic like dentistry stuff, I have a little bit more of a hand in, staff management, running of the office, looking at expenses, keeping that around because I'm planning to buy the office here in the next couple of months, which is pretty exciting.
What? That's brand new news to everybody.
Next week.
Nice. Well, let's get started. I'm having a bunch of questions come in. And again, we have some first year questions as well. So I do have one question right here. What would be your best advice for first year students when it comes to studying and lab work?
So one of the things that's tough is it's like a forest through the trees thing. Like you're going to have so much you feel that you need to do, especially in the first year and some of the second year, like didactically, where you feel like you can't get involved in the other thing. And I'd say don't fall into that trap. Like you're only going to go through dental school one time. Like every interest group, every study club, every ASDA meeting, anything that you think you might be interested in, go. Sure, you don't have a lot of time as a first and second year student, but they give you 2 days off every week to catch back up, and I just recommend, do everything you can, get as much experience as you can. The things that I think back to that I regret about dental school are things that I just didn't make time for, things that I wish it was like, I didn't want to drive back into Portland to go to this study club thing that I was able to go to. And it's like now, those aren't opportunities that are free anymore. So get everything you can, make the most of it.
You're living in the past, man. You're living in the past. No, and you heard that from the class president, District 10 trustee, that he wanted to participate more. So that's impressive.
Really?
What's the major difference you found in transition from student dentist to an independent dentist in the office?
Yeah, so the big thing is, when you're in school, and it's really fantastic at OHSU because, you have all the specialties involved, and, you're doing an exam or drilling on a tooth or whatever, and something happens, you go, oh, well, there's, literally hundreds of faculty in the building that you can go ask a question or bail you out. And the biggest thing was coming in and being, I'm the only dentist in my office. If I see something that I don't immediately know what it is or know what to do, there's not like someone I can turn over my shoulder and ask. But what's been great about with Aspen is there's such, like Derek mentioned, there's like 800 offices, there's over 1,000 practitioners. Like, we have found ways to stay in contact with each other. We have groups through Microsoft Teams and, text messaging and whatnot, where if I'm looking at a panel and I'm like, should I extract this? What are my options here? I can text another doctor, kind of get some advice. We have a implant support group, which has been fantastic. When that patient comes in, they're like, oh, I have this implant placed in Mexico, but I'm not going to go back there, and I don't know how to contact the surgeon. And you're like, well, how do I restore this? I just snap an image of it and I send it to implant support, and they go, oh, that is a 4.2, blah, blah, blah. This is what you need to restore it. And I can just order that, immediately and get that patient taken care of. So having that networking of the other doctors and the way to kind of stay in touch and utilize, that just wealth of knowledge has been kind of hard at first to figure out how to use. But once I figured out that part of it, it's just been really great.
Awesome. Kind of a two-parter too. So, based on that transition, what do you suggest for maybe somebody that is early, that is looking ahead into the future about doing it now? What would you suggest to them, knowing what the future looks like?
Yeah, it's one of those things, like you're going to have opportunities at dental school, like vendor fairs, and like I'll mention ASTA every chance I get, because it did so much to help me, where you're going to be able to network with all sorts of different people. And that's, people like Derek that are, recruiters for a company. That might be people that are in banking or insurance or these different things that you're going to need later. And I just advise you in your first and second year, take those business cards, meet people, because when you get into third and fourth and you're suddenly looking like, oh, I need disability insurance, I need malpractice, I need a job. It's nice to have a full contact list in your phone of people to talk to, emails to send, versus like, okay, I don't know what to do now. And that can be really, kind of daunting and overwhelming if you haven't made those connections.
Awesome. This is a really holistic question. How do you feel supported from working at Aspen Dental?
Oh, well, it's fantastic. And kind of like I mentioned earlier, when I came on, we knew that I was going to be going into an office as the solo doc there. So I did a little bit slower of an onboarding process. I worked with a dentist up in Washington for about a month, who's not only a multiple practice owner, but he's a super GP, places implants, he does sedations, he's just a whiz of everything. He's like a robot. I don't know, but I spent a month with him before I started my official onboarding program. And, him and the other doctors I've onboarded with have been such great mentors that I can, text or call them if I have questions. And just through going to the different trainings and the CEs that Aspen has you attend, we have one, it's called EDGE, which is kind of like your introduction into being the managing clinical director. You make all these contacts and you find all the the people, and then they're just at your disposal, like always, like not even just during working hours. Like I call my regional manager from time to time that, off work hours, like, hey, I'm having this issue, or I feel like I need to get this piece of equipment or this training or whatever, what are my steps to do that? Like the support structure of having, so many offices is just amazing. Like I said, there's like 1,000 practitioners that are at your disposal to help you.
1,200.
1,200, there you go, even more.
And 1,200 and counting. And you brought up a good point, and I wanted to briefly mention, Paul works for Aspen Dental. We work for two different companies. And I know it sounds weird, but we are the business support side. We're Aspen Dental Management. We are not involved whatsoever regarding any clinical decisions that happen in all 800 offices that we have. And I know that that's probably something for the first years that they will eventually find out is, I don't want anybody telling me what I can and can't do. We are the ones that fully support every decision that is made inside that office. We just want to be able to see how we can offer that. Can you elaborate a little bit on that, how the Aspen Dental Management side kind of helps you guys do your thing?
Yeah, for sure. Like, so what's really nice, and one of the reasons I went in on Aspen is I really wanted to focus on the dentistry piece of dentistry. Getting faster, building my skills, learning how to make my composite fillings not suck, stuff like that. And I've really been able to focus on those things through the avenues I've mentioned. And, as Derek put up that link, that the amount of CE that we have is just mind-boggling. Like, you can get CE on anything. So that's really where my focus is, the billing, the insurance, the hiring. I do not have to be involved in those things unless I want to be. Sometimes I want to be because, like I said, I'm looking at buying at the office and I want more of involvement there. But really, Aspen takes care of all the stuff that isn't the dentistry. They're going to do all of the, like Derek said, the business management stuff, and let you really just focus on getting good at the teeth part.
So we know each other now, obviously, and we met when you were a dental student. Prior to me being here, how did you become interested in Aspen Dental? When did you know that you wanted to join? And why did you decide us over other companies?
Sure. So that's kind of a long question. So I'll roll it back.
Three-parter.
To my original getting into dentistry. So I probably have the same background that all of you guys have. I graduated high school. I went into college. I got a degree in rhetorical analysis, found out that there really aren't jobs for that. So I opened my own martial arts school, like you do. And I ran that for about 8 years. Yeah, I'm watching Cobra Kai right now. It's bringing back
oh yeah, that's a good one.
Yeah, but I hurt my knees and I needed to do something else. And my wife was like, "We should be a dentist because my dad's a dentist." And I was like, "That sounds really gross, but I'll check it out." And I went and I shadowed him, and I found out that dentistry is just nerdy enough to hold my interest. So I got excited about it, and I went into dental school. Well, first I had to go back to college and do science because I hadn't done that before. But I went in with the, kind of the game plan of I would partner with my father-in-law and work in his office as an associate and eventually buy it. But during that time, the time I went to undergrad and the time I, spent at dental school, he kind of scaled back his practice of dentistry. So in my third year, I spent like a week with him, around Christmas time. And we kind of found out that there wasn't enough dentistry to be done in the practice for both of us, and it would probably tax our relationship to try to do that. So suddenly I was like, oh shit, I need to figure out what to do with my life. And luckily, through Aspen and the different things, I knew a lot of people. So I put out feelers to everybody, to Derek, the other DSOs. I talked to people I knew in private practice. And I just started with like, hey, I'm interested, I'd like to shadow, kind of do some different things. And I went pretty far down the process of, interviewing and things in several avenues. So not only just, the DSO route, but private practice, group practice, public health. I interviewed I applied for a prison. I didn't get the interview, but I always kind of wondered. I think that'd be some kind of a cool thing to do. But anyway, so I went through and I started getting these various, contract offers, and I was looking for a couple things. The big thing I was looking for was location. I knew that in Southern Oregon was sort of where I wanted to be, somewhere around there, because I have family down there. And the second thing is I wanted to have really good autonomy. I felt that that was really important to me. You know, I didn't want to have treatment that I didn't diagnose, that I didn't agree with. When I was on rotation, I ran into that a lot, where I'm like, you want me to do what to this tooth? You mean extract it, not put a filling in it, right? And I just didn't want to be in that situation again, because it just didn't feel comfortable. I always want to, whatever I do, I want to go like, yeah, I feel good about this. So those were my big things. Well, around the time I kind of started the process with Aspen, they invited me to this session called Vibe, where I went out and they kind of talked about what Aspen is and what it does, and, you know, kind of the network. And the CEO, Bob, he talked about how the company is really built on this central idea of saying yes to the patient. And that really spoke to me, because I'm a yes man, right? So their idea is, you know, like if you go to private practice and you walk in off the street and say, hey, can I get an appointment for a new patient exam, like right now, they're probably going to tell you no and reschedule you. Or if they do take you in, they're going to say, oh, can I get this, you know, tooth extracted right now? They're probably going to say no and reschedule you. Well, our day is that patient walks in, they're like, hey, I'm in pain. Can I be seen right now? And I was like, well, of course you can. You're here. So come on in. And then, you know, we'll figure out how to, you know, break down whatever barriers they have, be they financial, time, you know, whatever, to get them treated. And I think that's really powerful. I'm really proud of that, and I enjoy doing that. So I kind of liked the Aspen model. So that it was like, it had the autonomy pieces, it had the practice modality that I liked. The big thing now was location. So I forget who I talked to, but I talked to someone at the Vibe session. I was like, you know, I'm really interested in, you know, coming on, but I kind of want to live in this little circle of Oregon. And they're like, well, where? And I was like, well, there's a place called Grants Pass. And they're like, are you kidding me? Go tell that guy over there that. So I went and I talked to this guy named Rhett, and I was like, hey, I'm kind of interested in coming on, and they told me to tell you that I'm interested in living in Grants Pass. And he's like, who put you up to this? Because they were opening an office in Grants Pass, and at the time, the doctor that they thought was coming on, something had fallen through. So it was just like a kismet thing, where it really was like they could put me in the exact area that I wanted to be, doing the type of dentistry I wanted to do. So, you know, I still gave everything else a good look, but, you know, comparatively, especially, you know, after seeing a lot of contracts, Aspen's contract is like 2 pages. It's pretty much an at-will agreement to work. It's not, you don't feel like roped into anything. You know, I could leave whenever I want to and work across the street, and it wouldn't be an issue. I don't want to, because I'm really happy with what I do, but it was just that kind of like, wow, I don't feel trapped. You know, this looks like a really good fit. So I signed on, and I've been, you know, very happy with it ever since.
Do you remember exactly when you signed on as a D4?
Oh, geez. So I think I signed on at the end of my D3, honestly. I signed pretty early, because it was just like, you know, they had that office, and, you know, it's like, no, this actually makes sense. It checks all the boxes, you know. So I kind of signed early, which was good, because that allowed us to kind of look down here, find a house, you know, get really, you know, situated, you know, and knowing like, okay, I'm going to work right here, you know, now we'll look for a house that's close by, was really nice.
That's awesome. So I wrote a couple notes down on that I wanted to cover as well, and you feel free to add in as I talk about it.
Sure.
The one thing you mentioned is it opening up in Grants Pass, right? Well, we do not do any acquisitions as a dental support organization. We build everything from the ground up, and we go into business with our owners. So Paul is actually starting as he is being prepared for ownership. And the best part about that, and we'll answer some questions about ownership, is we will not go into business if we know there is still more work that needs to be done to bring that office up to success. That is the cost of doing business with us. In addition to that, it also shows that we're giving opportunity for ownership, anywhere from one office, as many as 5 offices. And sometimes back in the day, there's owners that are part of Aspen Dental that own like 25 offices. They're making a heck of a lot of money. But the sweet spot is about 5 offices. So you have the ability to continue to practice and you don't feel so spread so thin so that you're continuing to go into all those offices, and you're more of a manager of those offices at that point. You're still doing clinical work, but significantly less compared to let's going into 5 offices and having to do that every single day. So the work-life balance is absolutely amazing. You mentioned vibe. So for all those 2021s out there, raise your hands. Oh yeah, I forgot we're on a webinar. The 2021 students, we offer something called Vibe. Unfortunately, due to the pandemic, typically what we do is we have it in person and we fly you out to a location. Unfortunately, that's not going to happen by the end of the year. However, we are still having a virtual Vibe session. You will have an opportunity to A, learn, and B, just like Paul did a little bit earlier, is be able to potentially commit to where you want to start working so that you can focus on your studies by the time you graduate. So he brought up a really great point on that. Additionally, what is, and this is a question that came in, what is the benefit and limitation of buying in a DSO office instead of a traditional private practice? And I'll help you out with that if you have questions too.
Yeah, well, the thing about, I know when you originally think about if you're going to do a private practice versus, a DSO kind of ownership pathway where you're partnering in Aspen is basically the 55% ownership. You would think, well, if I'm taking 100% over here, 55% isn't as good over here. But really what you got to realize is that structure, that 800 offices allows Aspen to do a lot of things that private practice doesn't do. Big one is, our supply ordering. Our costs are so much lower than private practice because we are getting these, volume discounts. It's like going to Costco, basically. And that includes stuff like with our labs. Like, my father-in-law, works in the same town I do. He pays, $250 for a crown from his lab. I pay $40 for my lab. So it allows me to keep my expenses really low. Our overhead is very low. Also, the way that Aspen is structured, when you have 800 offices, you're really good. You really know how to make the office flow and be efficient. The volume of, procedures, production, the monthly amount that we're making is often way greater than what you see in private practice. So you have the benefit of working with ADME, having the support structure, having the business kind of taken care of. You've got all your people for that. At the same time, you're being able to get that 55% of a much larger pie than what you would have in private practice. Now, that said, when you talk about limitations or whatnot, like, in private practice, I guess you could do whatever you want. Like, I'm just not going to go to work today or whatever. And I think, when you're in a partnership, that's not something that you would do exactly. So, I mean, there's limitations, but there's sort of silly limitations when you really think about it.
Well, and on top of that, I know the biggest thing that we hear a lot is, I want my name on the wall, right? And obviously, that's a little bit different because for marketing purposes, we spend, I believe, somewhere around $170 in marketing to get new patients to come in. And we're talking day in and day out, 8 to 12 new patients every single day. That is kind of the cost of doing business. Additionally, I don't know if you've seen, but more often than not, you don't see, your name is literally on the wall, but your name, Aspen Dental, is going to be on the top for marketing purposes. I personally haven't really seen too many places that say Dr. Smith DDS right on the top. It's usually the name in order to make it more appealing anyway. So that's kind of, a counter argument to that. Additionally, I don't know if Dr. Lamoureux is familiar with this part, but the cost of doing business is significantly different, right? Once you graduate from dental school, you owe a heck of a lot of money back. To pull out a loan to open your own practice, we're talking like $1 million, $1.5 million nowadays. Well, going into business with Aspen Dental, since we have over 800 offices already open, we're talking half the cost because we're going to business with you. And on top of that, it comes at a significantly reduced rate because the amount of equipment and supplies that we purchase. So $1.5 million versus $475,000. There's a huge difference in price when it comes to going into ownership versus opening your own private practice. So we never try to scare anybody away regarding the idea of opening your own practice. It's a pretty scary number. So, you know, I think that those are some of the major benefits on top of what Dr. Lamoureux said about, you know, the cost of supplies and equipment. We're the second largest supplier of Henry Schein products in the United States, behind the federal government. So think about that. That's a supplies purchase. On top of that, we try to do our best to cover half, especially for some of the large. Tell me a little bit about, we have a question regarding Invisalign. Invisalign, if so, explain that part.
Yeah, and Invisalign, we just started doing Invisalign at my office, you know, in the last like month and a half or so. And it's fantastic. So we have an iTero scanner. Everyone is getting scanned at their new patient exam, which is amazing for case acceptance. It's very nice when it's like, here's a picture of your tooth, and here's the you know, instead of pointing to something, you see this little weird black triangle thing, that's a cavity. It's like, you see this hole? Yeah, we want to do something about that, right? So that's been really nice. But the other thing that's really cool is I have an Invisalign outcome simulator on it. We can just run that for the patient. It's like, you know, if you ever thought about, you know, orthodontics or whatnot, this is what we can do with clear aligners, and we can show them that. And, you know, they can touch it, move it, email it to themselves, play with it. We get a lot of people that get really excited about it because it's just never been presented to them. We also, same with that, you know, what we're talking about, volume discounts, we offer Invisalign cheaper than anybody else offers Invisalign. So it's a great value for the patients. It's a great service. It's really fun. It's also, it's a great thing for me because we do most of the Invisalign procedures out of my hygienist chair, and she's, you know, has restorative function. I pretty much only ever do IPR and do all the fun stuff where we talk about how good their teeth are looking and things like that. But, you know, she places the attachments, we get them their trays, you know, it's a lot of fun. I like Invisalign a lot.
Awesome. What hours does a new dentist work per week? You can talk about your hours too. And how much do they get paid?
Sure.
Money.
So the hours thing, the kind of the typical model for Aspen is on Monday, Tuesday, Wednesday, you're open 7 to 5. On Thursday, you're open 9 to 7. And then on Fridays, we work a half day. We work 7 to noon. So that's 40 hours a week or whatever. So that's your typical hours. Now, if you buy the office, you can change those a little bit. There's one in the town over that they didn't want to start at 7, so they started at 7:30. But other than that, the hours are, you know, all the same. So Friday they work 7:30 to noon 30. And then
how many hours a week? How many hours a week are you working?
40.
40, not 60?
No. Some days, some single days, it feels like I work 60 hours, but not very often.
No.
Yeah. And then,
sorry, you were going to say something.
Oh, I was going to answer the other half of the question.
Yeah, and I'd be happy to help you too.
Yeah. So you get a daily guarantee, which is very nice, and it's not a daily guarantee that expires after, you know, 3 months or something like that. Like, you always get your flat daily guarantee, which is great. But even going into my office, which is relatively newish and wasn't, you know, producing as high as a more established office, I've never only made my daily guarantee because we also get a profit share. The profit share is based on patient satisfaction. As a lead dentist, my profit share is between 16 and 20%. I usually get around 18 or 19%. I'm at 19% right now, which is great. So at the end of the month, we see how much the office made. We less my daily, what I've already been paid, and then I receive the remaining portion as a bonus at the end of the month. So I don't know. It always feels weird to say numbers stuff, but yeah. I make about 240-ish at the moment.
What?
And ownership will be quite a bit better than that.
So what I typically say is, especially starting as an associate, first of all, there is no cookie cutter way of the hours that are working, right? So depending on where you are and what the community says or how the community responds to hours, they will open more on certain days. Sometimes some of them work on Saturdays, but more often than not, Monday through Thursday are when the full days occur, and then you typically have a half day on Friday. Regarding the financial side of it, as an associate, you can make anywhere from $140,000 to as much as $200,000 straight up as an associate starting day one, depending on all those different factors that Dr. Lamoureux mentioned. Patient satisfaction, the success of the office, not the success of an individual, as well as any supply being spent, kind of the EBITDA side. And if anybody has any questions on that, we can talk about that offline. But the really great part is that daily guarantee ensures, especially during the hard months or the months that you might be taking vacation, that there is an amount that you are going to feel secure with. More often than not, what I've heard from a lot of our dentists is that they really thrive off of that profit sharing, meaning that if the office is successful, you are most likely going to be making significantly more than that daily guarantee that you're making. So we can always talk about that more in detail offline. If anybody has questions, you can always schedule a time. I do have a question here that I wanted to cover. I'm going completely out of order, so I apologize in advance, everyone. What about specializing? How would it work if someone like an oral surgeon, it worked for like an oral surgeon or endodontist in the office?
Yeah, so I have an endodontist that works out of my office once a month, and it's fantastic because, like Derek said, you're getting your bonus off of the office, the whole office. So when my endodontist comes in, it's not like, oh, I want to do these root canals because I need this production. It's like, no, I want him to do all the root canals. He's going to do them better than I do anyway. And I'm still getting a piece of that. It's fantastic. When my hygienist is busy and doing SRPs, I'm getting a piece of that. It's wonderful. When we sell an electric toothbrush, I get a piece of that. It's a great thing. So you're never in a position. I know, some folks that have went into some different pathways where they're paid off of, their production, but they don't do the new patient exams. So the older doc does all the crowns and they do all the filling. Yeah. I don't, if there's another doc in my office on a day for some reason and they do a crown, that's still something that's profitable for the office and therefore comes to my bonus. So it's really good. We have an oral surgeon that's going to be starting in November that I'm really excited about because currently I've been having to refer out for, sedation and things like that. Now we'll be able to offer that in-house. Awesome.
So this is a question that we got a little bit earlier on. How many people work in your office?
Oh, geez.
If you break it down.
Yeah, so there's me, there's my office manager. We currently don't have an assistant office manager. We have a PSR, patient services representative. They kind of answer phones, put in insurance, schedule patients. I have 3 DAs, a hygienist, and my lab technician.
Okay, so that's.
I got 8, I think.
I got 8 plus you is 9, right? So
yeah, me, I got that.
We're not math majors here, so sorry about that. And again, that's also not cookie cutter. It ultimately depends on which office you go in. Sometimes there's an office with 1 or 2 associates, a lead doctor, an owner. Sometimes there's just 1 lead doc. Sometimes there's just 1 owner. There's no specific way, but the things that we try to keep consistent are these 3 individuals. You mentioned endodontists, oral surgeons are once, twice a month. How many times a month are they coming for yours? Or were there plans?
Well, mine's just 1 time a month.
Okay. And then lab technicians in every office. So talk to me a little bit about kind of the experience of lab technicians when it comes to just having to walk down and knock on their door.
Oh, it's super nice. So like today we had, a case where I delivered a denture and, the bite just was a tiny bit off, and I tried some adjusting and some different things. And I was like, I'm not 100% sure what's going on with this. So instead of me trying to fiddle with it for, a few hours or send it out somewhere and be like, we'll get this back to you in a week or so, I just went over to my lab technician and I'm like, hey, Jason, this is what I've got in my chair right now. Can you come take a peek? And he's like, oh, yeah. So we looked at it together. We took a bite, or we just changed out, a tooth. There was just like some contact that we didn't like. Got the patient, taken care of in about 40 minutes. So it's wonderful having that person that their specialty is the denture. It also allows us to do a lot of things that you can't do in private practice. Like if you come in and you want, say, like a reline on a denture, in private practice, they're like, sure, I'm going to take this reline, I'm going to take away your teeth, I'm going to send it away. It's going to come back and you'll come back. And for however long that takes, you got to be without your teeth. I tell the patient, yeah, I'm going to take the impression, I'm going to take it back to the lab. You can either hang out here if you want, or you can, go home and we'll call you when it's done. And we get that done in just a couple hours. And it's something that's a really nice service for the patient. Allows us to move through denture steps, not only very, very quickly, but very accurately. If you think about, if you do a wax try and the patient has all these things that they're like, oh, I want this moved here and this here and blah, blah, and you got all these things. Well, you have to write all that down in some kind of way that a lab technician that you're not seeing in person will understand it and send you back what you want. If it's getting a little like that, I'm like, okay, I think I know what we want. Let me just bring in my lab guy so we can all three of us go over it together, make sure we're getting the right changes. And it's just something that's so powerful, and it's just it saves you a lot of appointments where you're having to send things back and forth because it wasn't right.
Continuity of care is what we.
Yeah.
If you just said continuity of care, I'm like, next question. Yeah. I mean, he's absolutely right. The ultimate goal is to make the patient first, and this is an opportunity to do that. And that's kind of the same thing with having an oral surgeon and endodontist walking in, is instead of sending them out, having to go through an entire another step, they're just coming back into the same place in order to take care of everything. And I think that's a very powerful thing to do, because you do have all those resources instead of having to refer them out or for it to take forever. I know we briefly went over this, and I want to go over it real quickly because I see a question that came in. How much oversight does the dentist have in terms of hiring assistants, managers, etc.?
It's one of those things as the managing clinical director, if I had an associate with me, it would, defer to me. But I sit in on all our interviews, and then my office manager, regional manager, and I will discuss candidates afterwards. So we come to a, collaborative decision about that. So I know some people that are in my position, they don't want anything to do with hiring and firing. So they stay 100% out of it. They don't go to interviews, they don't do anything. I like to be more involved, so I'm more involved. So it's one of those things you can kind of pick your level of involvement there.
That's the cost that our doctors, especially our owners, are paying for us for the business support side to take care of all of that. And as an owner, you have the ability to help in that if you'd like. However, we have an entire team that is a wrecking crew when it comes to finding the ideal individuals and making sure that they match up properly. So I think that's a great opportunity. Doctors hire other doctors, meaning that as the owner, you will be hiring and employing that other doctor. They work for you. Aspen Dental essentially takes care of hiring everybody else, unless you want to participate a little bit more in that. I know this is kind of right up your alley. If I start out as an associate, which you didn't, but think about that part, how quick can I become the lead and an owner? I'll help you out with that too.
Yeah, well, it's about where you go, because if you think about Portland, there's a lot of people that are kind of wanting to go in, there's less positions to take. So, I mean, if you come in as an associate under an MCD that's there, or under an owner that's there, unless they're transitioning for some reason, you might not have the opportunity to become the MCD in that office, or the owner. You might be able to partner, but that's a different thing. I kind of went about it in reverse. Not only was I looking, in this area, but I really wanted to look at office that I could eventually own. And luckily there was, like I said, it was just kidding. There was one right where I wanted to be. But you can actually, we're working with Derek out, like what offices aren't owned, you can kind of get in a pathway where you could get to that MCD or owner position quicker if you're willing to, go somewhere more rural. Is usually what it amounts to.
In addition to that, I know you probably owe a lot of money. And when I say you, I'm not talking to you, Dr. Lammer, I'm talking
Oh,
to
yeah.
everybody on. You owe a lot, you're gonna owe a lot of money back to for student loans. We offer student loan reimbursement up to, I believe, $250,000. If that's something that 100% motivates you to go somewhere, that's an option. Mentorship is a big option. That's something we can help you out with. If it has to do with working with the best doctors or the most busiest territory, because we have over 800 offices, we can help you kind of gear you towards what your short-term and long-term goals are. And you know, our major responsibility is to give you all of the paths and then for you to select your own path. So that's a great thing. We got a question in, will I do my own treatment planning?
Oh yeah, 100%. Like the only time there might be some, if you work in an office with, you know, multiple doctors, you know, if someone else might do a treatment plan and then you're seeing them for procedures, and you do what's kind of called calibration. You guys got to get on the same page, and through the interviewing and, you know, mentorship, you'll get there. But like, for me, I see all my new patients, I do all my own treatment planning, and I do all my own procedures. And then I talked earlier about the, you know, the employment agreement. What's really cool about that, the last page, there's actually kind of a thing that you sign that says, you know, if you're the only one that should be doing diagnoses and treatment planning, and if anyone else tries to do that or get in your way of that, you need to let us know so we can fix that problem.
Your license, your decisions. You know, obviously as an associate, nine times out of 10, a dental student, a recent graduate, will start off as an associate. Obviously that's a different story. For example, I feel like you need to improve your clinical skills. That's discussed with that owner or with that lead doctor or partner that's inside that office. And that's something that they will help you with. Dr. Amaro, I know you briefly talked about it, but tell us a little bit about kind of like your first month and how they helped you kind of.
Yeah. So I knew, like I said, like where I was going to be going. I was going to be ending up being, you know, the lead doctor down in Grants Pass. And I had sat down with, we have a physician called Territory Director, Becky, and she had been like, you know, are you good at extractions and surgery? And I was like, no, probably not. Because, you know, OHSU is great, but like, I know the oral surgery program's kind of under different people now, but when I went there, it was like, you know, you'd elevate on some tooth for an hour and then you'd have to go apologize to the resident about how you weren't good enough to get it out. And then they'd come and take it out with a handpiece for you and you'd watch and be like, oh, you're so cool. And that was my surgical experience. I don't think I touched a handpiece at OHSU. I touched one on my external rotation quarterly, and that was about all my experience. And I knew that I was going to be doing a lot of these things. So I was kind of upfront with that. I was like, yeah, I'm not comfortable with surgical extractions, really. And she's like, okay, good. I needed to know that. I'm going to send you up to work with Dr. Molesky. He's the super robot dentist up in Washington, Idaho. And he's going to give you not only like a tutorial in the business side and kind of like about treatment and stuff, but he's also going to give you like a mini surgical residency. And I got it was slightly over a month. My training with him just absolutely amazing. He had PowerPoints, he had step-by-step checklists. He's like, you know, we're going to watch, and you're going to watch me do this. I'm going to talk through it. You know, we'll do the next one together. And I learned just a ton of surgery stuff from him. And it really made me feel more confident. After that month, then I started my actual onboarding program, which is called the Doctor Development Program, which is generally speaking 6 weeks-ish. It can be longer or shorter than that, depending on the person. But I went with another doctor in Springfield, and I worked with her, and basically you're learning to work the flow. So the first couple of days, I just shadowed. And then, you know, after that, she had me start doing the production appointments. And she was really great. She's like, you know, talking about how you're going to do this extraction or filling, whatever. And I tell her, and she's like, okay, that sounds great. I'm just going to leave you to it. If you, you know, get in a spot or you have a question or something, just come grab me. So I did that. And after, you know, a couple days, other than learning I was a little bit slower than she is, she's like, okay, you're doing good there. Let's move you on to start working in the overflow appointments. So I'm learning how to, break from doing a filling and then go do, an impression or a denture step. And then after, a week of that, then we started doing the treatment planning, where I'd see the new patients and diagnose. And then all the time, those weeks prior, both with Dr. Molesky and Dr. H, when the x-rays would come up, we would go over it together, and they would be like, what are you thinking? What are your thoughts? Like, what needs to be done? And we're kind of learning, how to treatment plan and kind of working with their experience and getting that mentorship. And then when they felt like you kind of knew what you were doing a little bit, and they'd have you work with the patients. And I never felt rushed into anything, which was awesome. And then when I completed doctor development, so she kind of signed off on, man, you know what you're doing. And then I went down and I started my office, and we ramped. So I didn't go in and take over, do the Aspen Dental schedule like on day one. I kind of built up to it. Another thing to throw out is I also am in control of how long it takes me to do things. So if I want like, oh, when you start, you're like, oh, it's an occlusal on 19, I need 3 hours. You can have that. And then hopefully very soon you'll realize you could do it quickly. So I think I do for fills 15 minutes per surface plus 15 minutes for anesthesia. So like occlusal is a half-hour appointment.
So kind of to piggyback on that information, well, let me ask you this. Did you get paid to do training?
Heck yeah.
So that's a huge perk too, right? You go through the doctor development program, you're doing very few procedures, you're learning, you're understanding the culture, and you're also getting your daily guarantee rate, which is awesome.
And they flew me up their Business Plus.
Oh, classy. I want to be respectful of Dr. Lamoureux's time and everybody's time. It's 6:49, about to turn 6:50. We're going to do this for about 10 more minutes, and then any other questions we can always go offline about. Let's see. We have, this is like more of an experience. There's 2 of them. So I'm going to ask them kind of together. We're going a little bit backwards. What's something you regret or you wish you could have done differently when you were in dental school?
Oh, well, so the thing that my big regret was I had, when I was trustee, I missed something like, I don't know, like 60 clinic sessions, like a full month of clinic, just doing all the trustee stuff that I had to do. So I'm the only D10 trustee to ever visit all the schools in D10. Just that's how cool I am.
Classic.
So because I missed so much school, I had an opportunity where I could have gone on an overseas trip to work and do extractions and do a bunch of stuff, and I just felt like I was like, oh no, I'm already gone too much, I can't fit it in, and it's just like, I don't think that week of real world dentistry would have made it so I wouldn't graduate, and I really wish I would have done that. So that kind of goes back to what I was saying. It's like, don't let these opportunities pass you by. When you see that, go out with Dr. Beck and work on the extraction bus one night, like go do that. It's a lot of fun. Like you should do those things. So that would be kind of, I only regret the things that I didn't do, basically.
Awesome. Well, hopefully you're doing them now.
Yeah.
So what procedures do you enjoy doing the most and the least?
Oh, geez. So fillings are the ones I enjoy the least, because man, fillings, you learn that ideal prep. You never use that. You'll use that on your boards, but oh yeah, fillings are just always annoying. I'm not saying I don't do a lot of them. I'm pretty solid at them, but it's not like I don't get excited about a quadrant of fill. Where I'm having a lot of fun right now is full bony third molars and like tori removal, or just really like, I love the surgery stuff. I like flapping things. I probably do like now maybe 40-50% of my impacted third molars. I refer out the rest or whatnot. So I've been kind of building in that regard. So I really enjoy the surgery stuff a lot. I also really, really, really enjoy slam dunk endo, like, number 8 or something. I like that a lot, although even if I see it and I want to do it, I put it on my endodontist schedule. God can't just give him all the ugly stuff. Got to give him a treat too.
There you go. I got a couple of questions about PPE, and I'll just kind of format them.
Mm-hmm.
Obviously the pandemic has affected everybody. What is the office doing in order to maintain the safety of patients?
Yeah, so we have different, levels of PPE based on like what we're gonna do, and beyond that, kind of the big overall things we do. We take our temperatures every day. We take the temperature of all the patients coming in. We ask them a series of screening questions. We don't let anyone stay in the waiting room. We kind of have them call when they get there. We bring them in when we're ready to see them. We really kind of overall limit the amount of people in the office, and we always are wearing at least a level 3 mask in the office. Now, when we go into procedure, I'll be wearing, my lab coat, level 3. I wear my very awesome hair cover here. And that's what I'm going to do for procedures, exams, dentist stuff, that type of stuff. If I'm using the high speed, we're going to go into a full aerosol mode where I'm going to work in a room with a door that can shut. We're using the high-speed suction. On fills, we're using Isolite. Then I'm wearing the N95 mask, the level 3. I have a face shield. I have an overgown, like the whole works, gloves, of course, all that good stuff. And what's nice about it is I've never, during, when the pandemic was coming out and WHO and CDC and everyone was figuring out what we should be doing, Aspen's really on top of that. They were getting us the stuff we need. The only slowdown we had is when we got our N95 masks before we started doing the aerosols. We wanted all the, all the staff that was going to be using them to get their fit test. So, we had a couple days where we had to go out and get the fit test and then come back and start doing those procedures.
Awesome. Well, it is 6:54. I want to end off on one final question. I believe we did this last time. Well, first of all, I forgot to mention that when we're talking about PPE, you almost did your first live session with a mask on.
So, true.
So we know the safety procedures, and I'm sure you probably got a little flack for that if they found out that you weren't doing it. So that's
my door closed.
That's a good sign. That's a good sign. We always just try to find out a little bit more about you as an individual. I think last time I asked you what show was a can't miss. We're going to talk alcohol related this time. What is your favorite drink, and what drink do you hate the most?
So I'm not a beer guy, so I just don't really like beer. And then my kind of go-to drink when we're out and about is usually a Grey Goose Cape Cod, which is Grey Goose, cranberry, twist of lime. It's very classy. It's very refreshing, and I can drink a whole lot of them, which is good. And then the other drink that I like is called a Bouquet. It's a whiskey drink. It's French Quarter is what Bouquet is. But anytime I try to order it, no one knows what it is, and it takes too long to explain, so I never order it. So
you get a whiskey and Coke is my guess inside the when you go out.
There's some bitters and an orange peel and
there you go.
All sorts of fancy stuff.
And and we'll eventually have that talk at a future time because we need to catch up too. But I wanted to say, first of all, thank you so much, Dr. Lamoureux. I hope everybody enjoyed it. Virtually clap, everyone. Thank you. I'm kidding. So real quickly, again, for all those that kind of showed up super late, we covered the free Aspen Dental CEs. We're having a free opportunity for everybody. Aspen Aspen Dental dentists, and on top of that, for dental students. So go to aspendentalce.com/welcome. We'll have that available to everybody, and I'll send it out in a thank you email to everybody. In addition, if anybody has any questions, here is my contact information right there, as well as Dr. Paul Lamoureux. Don't bombard him. I think that would be great. But
Feel free to bombard me.
Okay, if he gives permission, you can bombard him. But thanks again, everybody. Do you have any last words?
Yeah, real quick, I just kind of scrolled through the questions. I know someone mentioned about BioClear. I have dabbled in BioClear. Aspen has a really great avenue for getting CE and equipment. So it's I've got a piezo laser I play with, all sorts of different things. So whatever, one of the first days I was in my office, they handed me the Henry Schein catalog, and they're like, order anything that you want. So I mean, it's really a really great place to to learn and kind of expand and grow what you do.
Yeah, I think we wouldn't be doing this type of thing, especially because he's doing this out of the kindness of his own heart, if he didn't love what he did. So, love you, bud. We'll definitely keep in contact. For all those 2021 grads, again, we're talking about virtual vibe session. We'll have some more information if you're interested, and I'll make sure to reach out to you if you guys are interested regarding that. But thank you, everybody. Have a great night. Goodbye, all you cool cats and kittens. That's like so old news. Okay. All right. Thanks, everybody. Thanks, Doc.
Bye.
Talk soon. See ya.